Dr. Phophi Ramathuba is the new Premier of Limpopo, replacing Stan Mathabatha, who served 2 terms as Premier. She was sworn in during the inauguration ceremony of the 7th administration at the Limpopo legislature. The former Health MEC has made history by becoming Limpopo's first female Premier. She joins us now to tell us more about her plans for the province. Dr. Ramathuba, good morning, and thank you so much for your time. Congratulations on your appointment as Premier.
Morning, Masechaba, and morning to all your viewers, and thank you very much for that message of appreciation.
Let's talk about your vision for Limpopo. What are your priorities for the first 100 days in office?
I think, Masechaba, as you would understand that as Limpopo province, the ruling party, which is the African National Congress, was given an overwhelming, a resounding victory by the people of Limpopo, which is a sign of showing confidence in us. And they've done that because we had a manifesto that was able to convince our electorate that we are still the organization of choice. Therefore, it will be very critical for one to be focusing on what we have promised our people. Secondly, we've been doing door-to-door. We've been actively on the ground, and we've heard what our people were crying about. Now, the most important thing is that we need to start with the plans, putting up a plan, and that plan will be informed by our manifesto. And that plan, top of the agenda, would be how do we get people in Limpopo to start to work, our young people. I mean, if you read Statistics General Resenga Maluleke's report, it tells you that fertility in Limpopo is very high. We give more children are born in Limpopo, more than even here in Gauteng. And I can attest to that because I remember in my past responsibilities as the MEC for Health, on a Christmas day, I can guarantee you I would kiss more babies than my counterpart, Panyaza Lusufi, will do in Gauteng.
All right. I love that you speak about the your economic plan for Limpopo. I'd like to expand on that a little bit because currently, as you know, like people who come from Limpopo would generally have to travel to Johannesburg, the city of gold, for work. So what is your plan at this point in time to grow the economy so that there are more employment opportunities in Limpopo?
Exactly. That's what I was coming in to say. Limpopo is blessed with a lot of natural resources, which we need together and find out what is it that is making our province not to grow as compared to other provinces, whereas it's well resourced. Firstly, if you look at the number of minerals that we produced in Limpopo, the reality of the matter is that we export more. We produce, and all our raw materials are exported raw as they are. And of course, while if you look at our GDP in the country, Limpopo contributes, minerals and mining itself alone contributes more than 7.2%, which is the highest compared to the other sectors. Whereas in terms of job creation, Limpopo agricultural sector and even trading, manufacturing, it's far ahead in terms of jobs creation. So we need to turn around the current situation by making sure that, firstly, the minerals that are being produced, we can start small. We don't export 100%. We start working with the business sector to make sure that what we are producing, at least 10% goes for processing in the province. At least we move to looking at the value chain towards even beneficiations. We need to also looking at the agriculture, which it's number 2 in terms of the potential of economic growth and job creations. If you, for example, that I always use, ZZ2 produce more tomatoes than any other a farmer I could think of in the country. But we don't even have a single factory in the province that it's producing tomato sauce. So if you look at the industrialization, Limpopo is one of the province which is has got more opportunity towards making sure that we build our industries, we build, make sure that industrialization program agenda is defined in our manifesto. It's being driven.
All right. So, Premier, you've been a champion for healthcare reform. What changes can we expect to see in the province's healthcare system under your leadership, especially in light of the fact that you have been heavily criticized for your stern approach to undocumented citizens?
Look, what is important here is that the recipe is one. We need to have the political will to implement policies which are all there, including the issue that you are raising of undocumented or foreign national. We have got policies, we have laws in the country which must be implemented. The reason why you finding ourselves in those difficulties like we were, you can't have somebody who is not leaving their own country just to come to Limpopo for surgical procedure. Somebody get an accident somewhere in the world and decide to say in Limpopo or in South Africa, I will get a free operation. Whereas in South Africa, we equally have our own challenges of people waiting for operations to be done. We are not talking about a pregnant woman who wants to give birth. We are not talking about somebody who got involved in an accident in the country. So I'm saying the political will to implement our policies will be my driving tool. Secondly, the strong leadership where decisiveness should be in every area. Why leadership fail? Because unfortunately we think sometimes we are ice cream, we can be loved by everyone, but we are money.
We're not ice cream, and we're definitely not money. So as a doctor,
by anyone. Yes.
As a doctor, Premier, how do you think we can create bridges between traditional healers and Western-trained healthcare professionals to facilitate collaboration and knowledge sharing?
You see, the good thing is that I am not here as the Minister of Health, but rather as a Premier of the province who, if jobs are created and our people start to work, I know even disease will go down, burden of disease will go down, because healthy people, in terms of research, are less often to get sick than those who are not working. And we believe that by creating jobs, you will get more people to be healthy, you will get more people to have their own houses and not dependent on the state. If you reduce poverty, life expectancy also will increase. So coming to the question that you are raising, which has to be dealt with by the Minister and the MEC of Health, is that firstly, which is what we did when we were still within the Department of Health, is to say we made a call to traditional healers to come on board and present their own standards, because they want us to register them. That is the first thing that they're saying. We are not bridging the gap because they are not recognized, but whereas we are, the Western doctors are recognized. You should understand that the Health Professional Council is there to regulate, firstly, the training of the profession, and secondly, when you practice as a profession, you are also regulated by them. But the challenge here is that the traditional health practitioners, they are the ones who must regulate their own profession. The HPCSA is regulated by the professions themselves, your doctors, your physiotherapists, and so is the nursing council. Nurses are regulating it. So is the pharmacy council. Pharmacists are regulating it. But here, with the traditional health practitioner, they expect government, we are not traditional health practitioners. Therefore, we can't regulate the standards as to what qualifies one to be a traditional health practitioner. So that is the work that the next MEC must continue to engage them, so that the standards of who it becomes a traditional health practitioners are developed.
Let's talk about the next MEC. In fact, let's talk about your cabinet. In a recent interview, you indicated that what we need is strong leadership in all our provinces. What does this mean for you? And most importantly, how are you going to select strong leadership in the province? And when will you be appointing your cabinet?
You know, the good thing about the African National Congress is that we have got a document called Through the Eye of the Needle. And that particular document is the one that guides whether from a branch level, when you want to elect BC member, you have to go through the eye of the needle, wherein you are going to look at the ethical leaders, the leaders that will inspire confidence amongst the masses. The leaders, you know, I hear people fight about cadre development, cadre deployment, and which for me, if I look at my own definition of which cadres would I deploy, firstly, it must be somebody who has the capabilities and the capacity to can do the work. Secondly, somebody who is qualified to can do that work. And thirdly, somebody whom once we entrust with that responsibility, they will able to execute it to their maximum and capabilities. And we are saying by following those principles and guidelines, that will inform the leadership that will be able to. But the lastly is that you should understand that as entrusted by the ANC to lead the province, you can't just wake up in the morning and say, I'm appointing this one and that one. Good leaders are able to consult.
All right, and then let's speak more about those good leaders. So, what legacy does your predecessor Dan Mathabatha leave for you, and how do you intend to take that forward? Very briefly.
I think the first legacy is that he identified me and some years back and invited me to join his cabinet, and that it's not an easy task to be able to get somebody that you invite, join your cabinet, be able to support you as a leader. And here we are today. It is under the leadership of Premier Stan Mathabatha that we saw the first ever post-1994 medical school built by this government, being there in Limpopo province with difficult situations, but we have been able to establish that. And the first group has already graduated. They are doing their internship and community service. So that is a legacy which South Africans really will not celebrate a lot, that a child from Limpopo, unlike some of us who had to travel to Gauteng to study medicine, they have got a choice, short left in Polokwane. If you look at what the collective leadership at that time has been able to do, if I just focus on the Department of Health, no one ever thought that you can have a CT scan in the rural hospital like Skukune or a mammogram. Nobody ever thought that a professor in orthopedics can come to a rural hospital like Butlopa and do an assisted knee operation procedure. Of course, we inherited during the time of Mathabatha a province where the Department of Health, of Education, if you remember, we were always at number last. But now, finally, we have been able to put up to the latest being, while we have not occupied the top spot, we have got 79.5% pass rate.
All right.
Coming from somewhere 34%.
Okay, so we know, and rightfully so. And you speak of, people coming to Limpopo today, the whole of South Africa, the eyes will be on Limpopo because the province is a host of the June 16th National Youth Day commemoration at the old Peter Mokaba Stadium. So as a premier, you'll be hosting the Deputy President, Paul Mashatile, who will be giving a keynote address. What message do you have for the youth on this day?
I think the current young people in our country, we know their frustrations, the fact that they are unemployed, and we are always reminding ourselves on this day to say, what would Peter Mokaba, whom we are hosting this event in his stadium, named after him, what would he have said when today parents are encouraging children to go to school? During our time, when our parents encouraged us to go to school, they knew when we complete, we'll come back and look after them. But today, the painful situation is that our children go to school, but when they come back, we still have to look after them. So I'm saying they should not be despondent. They should be there. We appreciate even in Limpopo that majority of the young people went in numbers to vote for us. So we are saying to them, they should not say, what is the point of going to school? Because I've seen many have put even on social media that you don't have to go to school. So I will still insist that the 76th generation who fought for us to go to school, government is providing resources for us to go and study, whether it's at basic education level from grade 1 to 12, or whether it's at a higher institutions of learning. NEFSAS is there to support them, and also for them to stay away from the drugs, to stay away from nyaupe, from alcohol. And if they focus on their education, and the girl child, remember the girl child must always remember to close up, while the boy child must remember to zip up, so that we avoid teenage pregnancy. And we should avoid.
Well phrased. Well phrased. I laugh, but it's not a laughing matter. But I just,
yes.
Yeah, I love how you phrased it. It's easy for them to understand. I just want to thank you so much, Doctor. I know you're extremely passionate about this, and I know that we could have this conversation all day, which I would love to. But I want to thank you so much for your time, and I wish you all of the best in your tenure.